Hello, I'm Michael Motes, and we're here at the 3rd Annual Society for Humanistic Psychology Conference at the University of Rockies in Colorado Springs, and I'm here with Rhonda Goldman. Rhonda is Associate Professor of Clinical Psychology at Argosy in Chicago. She's also an affiliate therapist at the Family Institute at Northwestern University, an author of a number of books, chapters, articles on emotion-focused therapy. And Rhonda would like to maybe start off with giving a little overview, but also maybe explaining what's really distinct and original about emotion-focused therapy.
Okay. Well, emotion-focused therapy takes a strong focus on emotion, and so we see emotions as important and adaptive. They tell us what we need. They orient us in the world, and they prepare us for action. And so, to some extent, if we don't have awareness of those emotions, we're in trouble. That said, there are some emotions that are very positive and adaptive and work for us, so that when you're sad, when you lose somebody, then you're sad, and it makes sense to be able to access that sadness and articulate it and use it. On the other hand, there are some emotions that we call maladaptive emotions that don't work so well for us, and these are often emotions that people feel very sort of dragged down by, and they're very repetitive, and they make them feel very bad about themselves and depressed. And those are emotions that we do see as important to access because they are there all the time when people are feeling bad. But we want to access them, but then change them. And so that might involve a process of grieving a past relationship, or working with a self-critical process and accessing how you're critical with yourself, so that you can find the strength in yourself to be able to fight back against those criticisms. So, so that's distinctive about emotion-focused therapy. There's more stuff. I mean, it is definitely a therapy that we don't get involved with a priori diagnosis, like before therapy begins. We don't do treatment planning, and so it's more of a moment-by-moment process constructive approach. So that when clients are talking about, or when they start expressing or talking about emotions that are meaningful to them, and say they begin to cry or they get very angry, those are like windows for us that tell us that this is important and we should focus on it, and we need to go in and explore that a little bit further. So, and then the other piece that is distinctive about emotion-focused therapy is that it's research-driven. So it's been recognized as a therapy that is by the Division 12 of the APA, the task force that looks at empirical support for treatments. It's been recognized and deemed a therapy that is empirically valid for depression, and it's research-driven as well, in the sense that we have models that guide our processes, that tell us when to go in and work on certain emotional processing problems that people have. When people bring in markers in therapy, we call them markers. But when people say, there's a part of myself that's being very critical with another part of myself, those indicate to us that we have to go in a particular way and start working with these self-critical processes. And there's a model that guides us through that. And these models are based on observation. So the research that's been done has been to observe lots and lots of different examples of those working with those self-critical processes across actual clients, and then using those observations of those therapy sessions to inform models and to build models that guide therapists. So.
Okay. And speaking of models, considering the various cultures and different clients that we work with, and emotional expression is different, doesn't always fit into the paradigm of the majority. How does emotion-focused therapy take that into consideration and work with that?
Well, I mean, we do talk about these emotional processes as universal processes in the sense that, I mean, the adaptive emotions in particular. And in fact, when you show people across, and we've done this, shown people across many different countries throughout Asia, Europe, South America, and show them a taped example of somebody being sad, people all seem to see that as, in fact, and recognize that as sad. So I do think that there are emotions that are universal, and people recognize them as such across culture. But at the same time, people have are influenced by culture, and specifically the cultural rules around the expression of emotion, and when it's permissible to express emotion and with whom. So it might be that around certain authority figures it's not acceptable to express anger, and that may vary from culture to culture, or people may have different display rules around the expression of emotion, and so people may have the emotions internally but not feel comfortable about expressing them externally. So I think there are differences across culture, but that there are also universal emotions.
Okay. For those that say the EFT is maybe a little too directive, or there's more emphasis on doing versus being, how do you see EFT and humanistic psychotherapy really coming together and working together?
Well, I think EFT is comes directly, it's a blend of client-centered and Gestalt interventions, right? So the relationship is very important. And so I think that, the most important, the number one thing that we do with clients when we start working with them is we build a relationship. We develop trust. And the understanding is that these emotions, which are very deep, sometimes vulnerable emotions, people are just not going to feel comfortable to express them with a person that they don't trust, right? So empathy becomes a very important process in that whole endeavor. So the relationship is very primary, and we're always monitoring the relationship. We're always aware of it, and so in a sense, when we're directive, we're directing. We don't so much see ourselves as directive as guide as much as we do guiding. So that we can offer people certain ways of working with their emotions and exploring emotions and getting to the core of, and the source of whatever may be making life very difficult for them. So we offer them processing proposals, in a sense, that guide them. But in fact, people have choice as to whether or not they want to explore or they don't. So, I mean, I think we are both leading and following. And I think the kind of cutting edge question is that we're always working towards and trying to differentiate is when is it best to try to lead in the sense that you're taking some initiative and making some processing suggestions, and when is it better to follow? And I think the rule there has something to do with if people are stuck and not able to access emotions, then we may take a more active role in trying to help them find ways to get underneath, to get to those emotions. But when people are able to access emotions, we're very much following, because they're the experts on their own experience. It's a process of discovery, and that we're in this co-constructive process with them, discovering what they feel. And so then, and particularly say if they were to express shameful or vulnerable emotions, it becomes so important and I always talk to my students and train them about this, it becomes so important to just stay with and be with and follow the clients. So, but the question just becomes one of when is it best to lead and when is it best to follow.